Well, COVID-19 has been a daily battle for healthcare workers all across the country, but there's still more to learn about this deadly virus. Some OBGYN researchers at OHSU are working to understand how COVID is affecting pregnancy. Joining me today to dig into this topic are doctors Nicole Marshall and Monica Rincon with OHSU's Department of Maternal Fetal Medicine, and Dr. Jennifer Lincoln, a local OBGYN whose expert advice on social media is reaching millions of people around the world. Thank you all for joining me this morning.
Thank you.
Thank you.
So first, let's just start off. Dr. Marshall, I want to ask you, what research is OHSU currently conducting on this?
So for the last few years, we've been studying how the maternal immune system impacts infant immune development, especially how things cross the placenta and help to protect baby for their first several months of life. And now with the COVID pandemic, we are pivoting to be able to study the impact of both infection and vaccination during pregnancy on protection for baby after birth.
Yeah, so why is this such an important area of study, and I guess one that maybe, is not as well understood just yet?
Right, certainly this is a novel virus that we have experience with other viruses, but not this particular one. And we know that viruses interact with the placenta in different ways, and they can impact both moms and babies. And so we really want to make sure that we're giving patients the best information about how to protect themselves and their babies. And we know that babies have the protection from moms from their first several months of life. And so we're really looking at what are the factors that influence that protection and how do we help keep everyone safe.
It's very interesting. Well, Dr. Lincoln, I know you are helping to harness the power of social media in this effort. Tell us a little bit about your outreach and how you're helping to get the message out.
Yes, so I did my OBGYN residency at OHSU, and when I was there, Dr. Rincon was a researcher and Dr. Marshall was a maternal fetal medicine fellow. So she helped teach me, and Dr. Rincon helped work in the department that taught all of us. So I feel like this is a way to give back and use social media from a public health perspective, where if we want to reach people and include people in studies, we need to go where they are, even if it's on TikTok.
Oh, absolutely. Now, for anyone who's not familiar with your channel on TikTok, you have videos covering a whole host of different topics that have gotten millions of views. Why is it so important to make this kind of information and to have this public health dialogue on social media?
Well, there is just so much misinformation out there, and that was well before COVID, unfortunately, but now that's just highlighting it even more. So using it as a platform to bust myths, and then also to say, hey, here are some studies, some local studies that if you qualify, you can sign up for and be part of the solution in helping us to learn more. And it's all about going where people are. We know that Americans spend 142 minutes a day on social media. So it's a really good place to go if you're looking for people to help out with enrolling in studies.
Wow, it sounds like a lot, more than 2 hours on social media, but when you think about how many times you probably check your phone, it definitely adds up. So Dr.
Yes.
Rincon, how can people get involved? Because yeah, again, this is a study here where local families can be taking part.
Yes, absolutely. So the Maternal Fetal Medicine Division has a unit that is dedicated to research during pregnancy. And due to the events that are happening right now with COVID, we are inviting everyone to participate in our study. We are trying to merge all our study visits with clinical care so that there is no extra trip to the Hill. We are doing virtual consultations so that people feel more comfortable if they do not want to travel. This in particular study is enrolling mothers that had been tested positive for COVID-19 during their pregnancy or even during the first year of lactation. Both English or non-English speakers are more than welcome to come and join us. You can find our information in social media or absolutely in the Oregon Health and Science University page in the Women's Health Research Unit.
Now, Dr. Rincon, you talk about women who've had COVID-19 either during or immediately after their pregnancy. If they were vaccinated as well, if it was potentially a breakthrough case, are those also women you'd want to talk to?
Yes, so the current study has two arms. One arm is dedicated for patients that tested positive, and the other arm is dedicated for patients that also received the vaccine, because we want to investigate both events that related to the virus.
Yeah, very interesting stuff, and hopefully research that will help many, many mothers and babies going forward here. Well, thank you all for joining me and digging into this really important topic.
Thank you.
Thank you.
Yeah, take care. And of course, if you know someone at home or if you want to get involved, we will have all the information you need for that OHSU study on coin.com.
I'm not a stalker. I'm a nurse. Help's on the way, okay?
The star of the new movie Danger in the Spotlight joins us next. We'll be right back.